Scars are something that we're all concerned about. Whether we've already had surgery or whether we're contemplating surgery, we all want the best possible outcomes following the procedures. As a surgeon, I'm going to tell you my approach to minimizing scars and what we can do to get the best possible outcomes. Scars can be very technique dependent. As a surgeon, I have to pay attention to various factors that can lead to bad scarring. For instance, the scar has to follow along what's called Langer's lines. So that means that there are lines of tension on our body that are horizontally created, which leads to folds and creases on our face. If we go vertical to those lines, we're creating more tension and more stress on the wound. Therefore, when an incision is made, for instance, if there's a bump on our forehead and we want to remove that bump, I make a horizontal incision that is parallel to these Langer's lines that occur on our face, on our bodies, and this minimizes the tension across the wound. If you make a vertical incision, there's greater tension there, and that tension leads to greater thickening of the scar. In addition, the technique of closure is very key, because what I have to do is to close the deep layer and the superficial layer in order to reduce tension at the surface. If you just close the top layer without closing the deeper layer, there's tremendous tension on the wound itself, and that tension leads to greater collagen deposition, and thicker scars can occur at that location. Now, there are certain parts of the body where the skin is very thin and you can only close the top layer without closing a deeper layer. For instance, on the eyelid, you can make an incision and close just the superficial layer and get minimal scars there. But if you're making an incision, say, on the cheek, and you have to go down a little deeper to remove the entire bump that you may have on your face or tumor, the wound should be closed in layers in order to minimize the tension. Two other surgical decisions I make to minimize scarring are the use of non-absorbable sutures. Non-absorbable sutures like nylon or polypropylene cause less scarring when the wound is closed because there's very minimal reaction by the body to those sutures. The surgeon chooses to use an absorbable suture, which of course is easier for the surgeon and sometimes for the patient because the sutures don't have to be removed. It can cause some significant scarring along the incision because the body reacts by breaking down this suture. There's a degree of inflammation associated with that breakdown of those sutures. So I would strongly advise you to recommend that you use non-absorbable sutures. The second thing is to minimize the amount of cautery that is necessary during the procedure. How does that impact you as a patient? Well, you have to stop any blood thinners prior to the procedure. That means Advil, Motrin, vitamin E, fish oil, omega-3, and other things that can cause blood thinning. Bleeding during the procedure causes the surgeon to use more cautery during the procedure, which leads to tissue necrosis and greater degrees of inflammation and secondary scarring. So it's good as a preventive step to not use any blood thinners prior to the procedure. Additionally, I tell the patient that following the procedure, they need to avoid sun because the sun can stimulate the collagen deposition and thicken the scars. So you don't want to plan a vacation immediately following a face procedure in particular, where you go out in the sun and you have a lot of sun exposure and so forth and so on, which can lead to greater thickening of the scar. In addition, you got to keep your wounds moist following surgery. So the best thing to keep your wound moist in most places on your face would be to use silicone gel rather than an antibiotic ointment. And you want to keep the wounds moist because moisture enhances the healing process. If the wound dries out, it can get thicker and dry, and sometimes the wound ultimately won't heal as well. Now, an additional step following surgery for the surgeon would be to use Botox. So I use Botox within 3 to 5 days following the surgery, and I found that my scars actually look a lot better. And the question is, why is that happening? Well, Botox, of course, inhibits neurotransmitters, but it also has some kind of biochemical effects that are a little mysterious, and we don't have a clear understanding of how it works, but it probably also relaxes the wound a little bit and allows the collagen to be laid down in a much more organized way. But we're not entirely sure how it works. But we do know injecting Botox within 3 to 5 days following a procedure, particularly on the face, can reduce scarring. Now, once you have scarring, there are different kinds of scars, by the way. There's atrophic scars, hypertrophic scars, and keloids. I'm going to try to break down each one of these and tell you how I approach each one of these. So atrophic scars typically on the face occur following long-standing acne, where people have recurrent acne breakouts. They have injections of steroids and various treatments over many years, or maybe they had multiple laser treatments that's caused atrophy of the face. And those patients require multiple injections of micro Botox, like meso-Botox injections in little spots over the face around the scars. And then sometimes we have to build up those atrophic areas, injections of silicone to elevate the depressed areas. Fat grafting has not been found to be very effective in reversing the atrophies that has occurred following those long-standing acne breakouts. Now, if you have a thick scar, a hypertrophic scar, that usually occurs within the area of the incision that has been made. So people can form thick scars generally because there's a lot of tension across the wound in those locations, or they just have a genetic propensity to form thicker scars in areas where either trauma or incisions have been made. In those cases, there are many different approaches to reducing that scar. I like to use what's called 5-fluorouracil injections in tiny amounts into the scar tissue itself, directly into the scar and not below the scar, and in a sequential way, meaning it may take several weeks and 5 times, maybe even 10 times, but I have been able to reverse scars that look like they could not be reversed with just an injection alone, that some people thought they might need to have surgery to reverse. In fact, there are people who've had scarring of the lower eyelids which have been pulled down and they develop ectropions of the lower lid, and I've injected 5-FU over several weeks and reversed these scars and prevented them from having major surgical reconstructions performed in order to reverse those cicatricial scars. Besides 5-FU, other surgeons might recommend using steroid injections. And I'm not a big advocate of steroid injections into scars because I have found that I get some atrophy in the area of the injection. And the atrophy can last for 6 months to a year following the procedure. So I try to avoid steroids in combination with 5-FU. 5-FU I don't find to cause significant atrophy of the tissues. It may cause some discoloration in the area where I inject it. Atrophy is not one of those problems that I find to be common. In addition, you can use other techniques to reduce scarring. Sometimes there's an inflammatory component to the scar. It can be raised and red and inflamed, and in those cases I might use a pulse dye laser treatment, which has been shown to break down the transforming growth factors in the scar tissue. And if you do that within a few weeks of the surgery, you can also reduce and minimize the scar. Some people develop hypertrophic scars under the breast and along where people have had abdominoplasties or tummy tucks, and those scars can also be improved with either silicone sheets, which are at least topical applications of these silicone sheets that can be applied under the breast or on the abdomen and worn continuously for several weeks to months in order to reduce the scarring that's occurred. But I don't find silicone to be that effective. I think direct injections of 5-FU can be very effective in those cases as well. Hypertrophic scarring has to be differentiated from a keloid. A keloid is an outgrowth of scar tissue beyond the limits of where the incision was made or the puncture was made in the skin. And it may happen weeks to months to years after the initial trauma to the skin. And it typically occurs in certain races. So people of African descent, Asian, or Hispanic backgrounds typically can form keloids. Not always, but it's more common amongst those groups. I've only seen one Caucasian patient who've developed a keloid in my career, so it's very uncommon amongst Caucasian people to form keloids. Now, keloids can cause pain, they can itch, they cause a lot of disfigurement, which can be very distressful for the person. So it's not something incidental. And the approach to treating these keloids is very different than with hypertrophic scarring. Hypertrophic scarring is amenable to injections and laser treatments and so forth, but keloids typically require surgical excision of the keloid, followed by almost immediate treatment with radiotherapy. So the care of a patient with keloids has to be coordinated with other specialists in order to achieve the best outcomes and prevent recurrences, because recurrences are very common amongst keloid patients, because if you just go and excise the keloid itself, the surgeon like myself excises it and doesn't follow through with radiation therapy, then the chances of recurrence are extremely high. So my patients are immediately referred to the radiotherapist, and they use electron beam radiation to treat these keloids over a 3 to 5 day period, and that will reduce the recurrence rate by about 80%. Now, sometimes I also will use some local injections of 5-FU if I feel that I can supplement and improve the outcome of the radiation therapy. If the keloid has developed on the earlobe and you've excised the keloid, if the surgeon has removed the keloid and you've had radiation therapy, usually it's followed by the use of a compression earring. It's been found that by putting compression on that area of the surgery, it also enhances the final outcome and reduces the chance of recurrence. So in summary, I've given you an overview of different types of scarring, the thought process that I take as a surgeon to prevent scars in the first place, and how to mitigate scars should they occur. If you have any further questions, please leave them below. I'm more than happy to answer them, and I hope I've been helpful in your journey to treat scars.